Hello everyone, welcome to Med Ed World. Today's topic of choice is anatomy of ear. Here we'll be studying about anatomy of external ear, anatomy of middle ear and anatomy of inner ear. First we are going to start with anatomy of external ear. The external ear comprises of this outer part which is known as helix, this inner part known as antihelix. The center is known as concha. This prominence is known as tragus. This prominence is known as antitragus. This triangular depression is known as triangular fossa. This lower part is known as lobule. This portion is known as cymba conchae, which serves as cartilaginous landmark for mastoid antrum. This area is known as insula terminalis. This is devoid of cartilage. This prominence is known as Darwin's tubercle. It is an atavistic feature located at upper 1/3 and lower 2/3 junction. Next we are going to see about external auditory canal. The total length of external auditory canal is 24 mm, out of which the outer 1/3 is cartilaginous, which is 8 mm, and inner 2/3 is bony, which is 16 mm. To see the external auditory canal, we pull the ear upwards, backwards, and laterally. The cartilaginous portion contains hairs and ceruminous gland. The narrowest portion of external auditory canal is known as isthmus, which lies 6 millimeters lateral to tympanic membrane. The cartilaginous parts contains two fissures, which is known as fissures of Santorini. By which the infection of external auditory canal can spread to base of skull and parotid gland. The bony canal consists of two openings, which are known as foramen of Hashke, which usually closes by 4 to 5 years of age. Next we are going to see about the nerve supply of the external ear. The majority of the nerve supply of the external ear comes via greater auricular nerve, which supplies majority of the pinna and external auditory canal. Some portion of the upper part on the medial surface of the ear is supplied by lesser occipital nerve. The auricular temporal nerve supplies the anterior wall and roof of external auditory canal and anterior part of ear. The posterior wall and floor is supplied by vagus nerve of external auditory canal. The referred pain from parotid gland and anterior two-third part of tongue comes via auriculotemporal nerve, and the referred pain from the cervical spine mainly C2 and C3 comes via greater auricular nerve. The referred pain from larynx comes via vagus nerve. Vagus nerve is known as Arnold's nerve. A small portion on the posterior superior part is supplied by facial nerve. Next, we are going to see about McEwen's triangle. McEwen's triangle serves as bony landmark for mastoid antrum. The boundaries are superiorly its temporal crest, anteriorly its external auditory canal, and third boundary is the tangent joining both the two. Now we will be seeing about the tympanic membrane anatomy. The tympanic membrane consists of this upper outer one-third portion which is known as pars flaccida and this lower portion which is known as pars tensa. The pars tensa is dented by the handle of malleus which is known as umbo. The umbo forms the cone of light. The cone of light tells us about which side tympanic membrane we are seeing. For example, if the cone of light is at 5 o'clock position, we are seeing at right sided tympanic membrane. If the cone of light is at 7 o'clock position, we are seeing left sided tympanic membrane. The tympanic membrane arises from all the three germ layers. Color of the tympanic membrane is pearly gray. It makes an angle of 55 degree from the horizontal. Total vibratory area is 90 millimeter square and effective vibratory area is 55 millimeter square. The tympanic membrane has two borders, anterior border and posterior border. The posterior border is tilted more towards external auditory canal and anterior border is tilted more towards middle ear. Now we will be looking up into the middle ear cavity. The middle ear cavity is just like a room. It consists anterior wall, it consists of posterior wall, it consists of roof, floor, medial wall and lateral wall. The lateral wall is formed by tympanic membrane. The most important is medial wall. This is the internal acoustic meatus. From here comes the facial nerve. This turn of the facial nerve is known as genu, and the ganglion here is known as geniculate ganglion. This is the bulge produced by lateral semicircular canal. This is the horizontal part of facial nerve. This is the promontory. It is the bulge produced by base of cochlea. This is the oval window. Here the footplate of stapes is attached, and this is the round window. This is processus cochleaformis. From here, the tensor tympani muscle, which comes from the anterior wall, takes a turn and it's attached to handle of malleus. Next comes the posterior wall of the middle ear. This is the posterior wall. This is mastoid antrum. This part is known as aditus. This is the facial recess area. From here, we put electrodes of cochlear implant. Through the round window. The boundaries are on the lateral wall. This is chorda tympani. Which supplies taste sensation in anterior 2/3 part of tongue. The medial wall is vertical segment of facial nerve. This here is known as fossa incudis, which is the depression formed by short process of incus. This hair anteriorly to the vertical segment of facial nerve is known as pyramid. Here the stapedius muscle is attached, which is responsible for stapedial reflex. Next comes the anterior wall. The chorda tympani exists from anterior wall in a canal which is known as canal of Huggier. Anterior wall has eustachian tube opening and internal carotid artery lies close to the anterior wall. The floor of the middle ear cavity consists of jugular bulb. In the floor here, the jugular vein passes, which forms a bulge known as jugular bulge. Along with the internal jugular vein, here also lies glossopharyngeal nerve, vagus nerve, and accessory spinal nerve. The glossopharyngeal nerve gives a branch which is known as Jacobson's nerve. It forms the tympanic plexus. On the promontory. Next, we will see about the ear ossicles. There are 3 ear ossicles, namely malleus, incus, and stapes. The malleus consists of an anterior process, a lateral process, the handle of malleus, and a head and neck. The incus consists of a short process, a long process, and a lenticular process. The stapes consist of anterior crura, the posterior crura, and a foot plate. The malleus and incus are derived from first pharyngeal arch, and stapes is derived from second pharyngeal arch. The joint between malleus and incus is saddle joint, and the joint between incus and stapes is ball and socket joint. Next, we are going to see about the anatomy of inner ear. The inner ear comprises of 3 semicircular canal, namely the superior semicircular canal, the posterior semicircular canal, and the lateral semicircular canal, also known as horizontal semicircular canal. The superior semicircular canal and the posterior semicircular canal have a common opening which is known as pars communis. Next is utricle and saccule, and then comes the cochlea. The cochlea takes 2.5 to 2.75 turns around a pyramidal process which is known as modulus. The inner ear consists of two parts known as bony labyrinth and membranous labyrinth. The bony labyrinth consists of perilymph and the membranous labyrinth consists of endolymph. The endolymph is produced by a structure which is known as stria vascularis and is absorbed in endolymphatic sac. It lies intradural between the two layers of dura mater. To find the location of this endolymphatic sac, we make an imaginary line from the lateral process of which is known as Donaldson line. The endolymphatic sac lies beneath this Donaldson line. This bulging structure is known as ampulla. It consists of cristae which are present in semicircular canal and are responsible for rotational acceleration. The utricle and saccule consist of maculae which is responsible for linear acceleration. The cochlea consists of outer hair cells and inner hair cells. The outer hair cells are more in number and more prone to damage by loud sounds. The inner hair cells forms the cochlear nerve. This membrane is known as basilar membrane. The upper part is known as scala vestibuli. The lower part is known as scala tympani and the middle part is known as scala media. This scala media consists of endolymph and scala vestibuli and scala tympani consist of perilymph. This hair is known as tectorial membrane. This membrane is known as Reisner's membrane. This was all for today. Thank you. Please like our video, share it with your friends, and please subscribe for more content like this. Thank you.